Right now, respiratory illness activity is high in Wisconsin, and urgent cares and clinics in our area are extremely busy. Today, we're talking with SSM Health's Dr. David Ottenbaker, the Vice President of Ambulatory Clinical Programs, about what local doctors are seeing and how you can be seen quickly when you need medical care. Dr. Ottenbaker, thanks for being here with us.
Yeah, thanks. Appreciate being here.
Of course. So let's just start out. What are you all seeing at area clinics and hospitals right now?
We certainly are in the midst of the upper respiratory season. We are being overrun in our urgent cares and in our primary care offices with a lot of the upper respiratory illnesses that are out in the community.
A lot of people just traveled and were around extended family for the holidays. Are we starting to see an early peak to the viral season?
It actually started even before the Christmas New Year's holiday season. We started to see really high numbers. The influenza might be tapering off a little bit right now, but we're still, I would say, in peak season at this point.
In terms of who's getting sick right now, are these viruses affecting all ages equally, or is it any one particular age group that's getting sick?
It's certainly been across the board. We're seeing a lot of influenza and COVID, but also RSV. But basically across the board, I think one of the bigger contributors for influenza could be that our influenza immunization rates were down significantly this year as opposed to traditional years, and that may be contributing to some of this.
Interesting. If someone isn't feeling well and they're kind of waffling, should I go to the doctor, should I not? What's that threshold for when someone should go in and get medical care?
I think first you want to evaluate, are you high risk? So are you somebody who has a chronic disease or elderly or the very young? You might want to consider the bar a little bit lower to come in and at least seek advice or care. I think if you get a run-of-the-mill upper respiratory infection, even with a fever, stay home for sure. You can be tested if you want to, know that you have COVID or not. You can certainly, do a home COVID test. We'd recommend that. I think if you're feeling that you need to be seen, we have a lot more alternatives now. We really are trying to encourage more of our telehealth options, and we clearly use them well. We learned a lot about that over the last couple of years. For the consumer, there are shorter waiting times for that. They can be diagnosed. They can even get prescription treatment if they need it in that setting. Some of our urgent care waits can be 1 to 2 hours based on how busy they are, and again can be difficult to get in to see their primary care physicians as well. So there's a multitude of different options now, and we would certainly suggest that if you feel you need to be seen, to consider those options as well.
All good options if you are sick, but obviously not getting sick is the preferable thing there. What can we be doing? What should we be doing to prevent these types of illnesses?
It's the same things that we've been talking about really since the beginning of COVID. Is obviously if you're sick, avoid people who are ill. And again, good hand hygiene. Try to avoid big gatherings in a closed space right now, which again was really what was happening over the holiday season. So just be a little bit smarter about that. But again, just getting enough rest, make sure you're hydrated well. All of those common sense things that we preach to people.
A lot of really good information today, Dr. Ottenbaker. Thank you so much for being here with us.